a show of hands, how many here have been injured, been hospitalized, or have been had surgery? Have you all been taken care of by a nurse? When you think of nurses, you think of the one who pushes the medication cart, putting the Band-Aid on the boo-boos. That's what you think of as a nurse.
No.
Good evening, Madam Toastmaster, fellow Toastmasters, and guests. In reality, at any given moment, you're juggling 5 to 7 wobbly patients, have medications in one hand, have IV bags in the other hand. We are, while people are timing us for their next dose of pain medication. All while wiping patient tears, holding hands, and saving lives without tending to our own needs. These little things would include going to the bathroom, eating, all in a 12-hour plus shift, not including charting, and severely understaffed. This is the nursing reality, not an enigma. Tonight, I would like to discuss the growing trend of violence against nurses. In 2011 to 2013, nearly 75% of all workplace assaults happened on hospital property. Between 2000 and 2011, 154 shootings with injury occurred on the grounds of U.S. hospitals. 80% of emergency medical workers experience physical violence, as well as 39% of nurses report verbal assault each year, and 13% of them are reporting injury. In 2015, 21% of nurses and nursing students were physically assaulted. Over 50% were verbally abused. Time lost from injuries, 80% from patients hurting the nurses and nursing staff. So, with all being said, let me put away my strangulation device. Nurses have been reporting that they're afraid of retaliation from their employer for reporting their injuries. Currently, it is a felony in Florida for if you work in, it's only a felony in Florida if you work in the emergency department. And there is signage in some emergency rooms, and that's about it. Nurses did not sign up for combat or punching bag duty, nor do we receive the pay. The project I was working on in my master's, when I was working on my master's in nursing education, had to do with nurses teaching nurses, and what I wanted to do was make it fun. So what I ended up doing is the nurses, I had props, and they had little things that they could work on, like almost like an event for themselves, while they would act out their most outrageous situation. So this is where it all started. This nurse right here did her poster. The affect of the student learners, the nurses, and there was text there as well. And they came in and did not want to be there. They're overly jaded. They did not want to even do it. So I had to turn that around, because I know if you laugh a little, you learn. So as you can see, she's starting to dress up. She decides to hold up this coworker, which is also an ER nurse, with a fake gun, dressed up, and he's trying to talk her to calm her down. So that's what's going on here. So I took the situation and I tried to have them live their situations that really upset them while they were on the floor. And there's many stories. So, and it continued. I mean, they just got seriously funny. And this nurse in particular that's laughing was overly jaded, we'll just say. She did not want to have anything to do with it. So it was quite a success. So what my next, now I'm working on my doctoral nursing practice. And what I'm working on is the beginning stages of a prevention model. The 3-step prevention model involves be aware of the patient situation. As soon as the patient hits the floor, they're already having anxiety, they're nervous, they don't know what's going to happen. It's the fear of the unknown. It's awareness. Second step to prevention, the patient may show anxiety by pacing, rubbing their hands, touching their face, talking louder as you can see that they're getting physically agitated. They could have an underlying psychiatric illness. They could also be withdrawing from drugs. You don't know, they're too ashamed sometimes to tell you. They also might have childcare issues. They're there, they don't know why. Their heart's hurting. They don't know what to do. They could be having a panic attack. Third step is conflict resolution. Get in that patient's world. It is important. You can resolve a lot by just understanding and taking the time out to get to know them. Just a little bit, ask if you can call somebody for them. This is just some more training that I'm going to be doing. So this is the birth of Nurses Against Violence, Unite. And we have a handout that's going to be going around. And basically what I'm going to be doing is I want to have an education program. For acute mental health, there's not a lot of acute mental health in nursing programs. Provide a safe environment for all healthcare workers and patients and their families. Eliminate workplace intimidation for reporting injuries or belligerent behavior. And bring awareness to the community that nurses are being injured. Also provide scholarships for nursing students for books and for supplies that they need. So this is my nonprofit that I just got started.